Hi folks, welcome back to Nurse Nita again. Today I'm gonna talking about the most high topics that always be tested on the NCLEX exam. Today we're gonna focus on acute myeloid leukemia. Acute myeloid leukemia or AML. Do you know why NCLEX loves to test you about the acute myeloid leukemia? Do you know why they love it so much to test you about this? Because acute myeloid leukemia is the most common disease. Acute myeloid leukemia is the most common disease that happen to the patient, and it can cause a lot of complications. So that's why NCLEX want to test you about this disease. And the most important thing is NCLEX concerned about patient safety. And the key role of the nurse is to help prevent the complication of this disease. So that's why you always be tested about the acute myeloid leukemia. Okay, today we're gonna focus on what happened in the patient with acute myeloid leukemia and the complication that we need to watch, and the treatment and the nursing intervention. Acute myeloid leukemia or AML is a cancer. Yes, it's a cancer. It's a cancer of the bone marrow, or it's a cancer of the myeloid blood-forming cells in a bone marrow. Acute myeloid leukemia is aggressive disease and is required prompt diagnosis and treatment. What happened to the patient with acute myeloid leukemia? There are 4 important things that happen to the patient with the AML or acute myeloid leukemia. 1. Decreased neutrophil count, or we call it neutropenia. This can lead to a reduced ability for a body to fight the infection. So with the acute myeloid leukemia, the patient will get easily infection, okay? Because the patient has less white blood cell than usual. That's we call neutropenia. 2. Increased blast percentage. The blood cells are immature neutrophils. This can cause other cells die, and it can cause a lot of signs and symptoms. 3. Decreased platelet cells or thrombocytopenia. When the platelet cells is decreased, it can cause a longer clotting time. So the patient with the AML will be easily to have a longer bleeding time. It means that easily bleeding or bruising. 4. Decreased erythrocyte. It means the patient has anemia. The decrease in erythrocytes often leads to anemia, which is the part of the AML. So this is 4 important things that happen to the patient with the AML or acute myeloid leukemia. So it can cause a lot of complication. What complication? This is the key part that you need to remember, because the NCLEX always tests you about this. Now we're gonna talking about the complication that we need to watch as a nurse. NCLEX want you to know about the complication of acute myeloid leukemia, because you are the key person that can help patient to prevent the complication by using the right nursing intervention and education to the patient. Before we go for the nursing intervention, we need to know the complication of the leukemia, of the acute myeloid leukemia first. So first is neutropenia, or decreased neutrophil count, neutrophil cells. With the neutropenia, the patient will get easily to get the infection and sepsis, because the patient will lose the ability to fight the infection because of the neutropenia or decreased neutrophil count. So the patient will get infection and sepsis easily. So the key thing is you need to prevent the infection and sepsis in the patient with acute myeloid leukemia. 2. Thrombocytopenia. Thrombocytopenia is decreased platelet count. So the patient will get bleeding, hemorrhage, bruises easily. So the key part of your nursing intervention is to prevent bleeding. 3. Tumor lysis syndrome or TLS. Tumor lysis syndrome is one of the complications in acute myeloid leukemia, and it is a deadly complication because it's a rapid cell destruction after the chemotherapy. This is a tumor lysis syndrome. When the tumor lysis syndrome happens, it means the cell is burst. So the inner thing, the things that inside the cell will go out to the bloodstream. So we think about what kind of thing that we found most in the cell. Potassium, some electrolyte that will go more in the bloodstream, so that can cause the complication. So that's why tumor lysis syndrome is very, very important, and it's a deadly complication that could be happen to the patient in acute myeloid leukemia, especially when the patient has the chemotherapy. Okay, so number 4 is disseminate intravascular coagulation or DIC. DIC is the most important complications as well because is a deadly complications as well, especially in acute promyeloid leukemia or M3 AML subtype. This is the most complication that you need to keep eyes on it. You need to assess, monitor, and prevent it. Now we go for the treatment. The main treatment of the acute myeloid leukemia is induction chemotherapy to destroy leukemic cells. So we need the prompt treatment. Chemotherapy is one of the treatment for the acute myeloid leukemia. And then we need the stem cell transplants for eligible patients after the remissions. And then we may need the antibiotics, antifungals for the infection prevention. We might need the transfusion for the patient with anemia and thrombocytopenia. And patient may be prescribed the Allopurinol or respiratory acid to prevent tumor lysis syndrome. And then we come for the nursing action. We will focus on the complication that could happen to the patient. So we go for the neutropenia care. We need the infection prevention and the neutropenic precaution. Neutropenic precaution is one of the infection prevention that includes no fresh flowers, no fresh plants, that because it might carry the fungal spore, and the patient need to avoid raw fruits or veggies because it risks for infection. Hand hygiene is a priority action for the nurse and for the patient. And we might need to limit the visitors, especially the sick ones, to prevent the infection to the patient. We need to use a mask to protect patient from airborne pathogens. Okay, and when we focus on the thrombocytopenia care, we need to apply bleeding precaution or bleeding prevention. We might avoid IM injection, or we need to educate the patient to use the soft toothbrush, monitor the platelet count, the lab for that, okay? And then we go for the anemia care. We need to monitor the signs and symptoms of the anemia, like fatigue, and we might need to provide the oxygen to the patient to support the patient if needed. Blood transfusion may need it if the patient has a severe anemia. Mouth care is very important as well. We should rinse with the saline, avoid alcohol-based mouthwash because it could irritate the patient mouth. And emotional support. AML patient is aggressive sometimes. We could provide the psychological support and the education to patient. Okay, all of this is the key part of the acute myeloid leukemia that always be tested on the NCLEX exam. I hope that this could help you more understand that when you study about acute myeloid leukemia for the NCLEX, which part you need to focus on for the NCLEX exam. Now we're gonna go for the example question of the acute myeloid leukemia. You read the question number 1, number 2, you pick your choice, and then we will talk about the answer. Okay, we go for question number 1. A client newly diagnosed with AML has a white blood cell count of 50,000, mostly blast, and neutropenia. What is the primary nursing diagnosis? A. Risk for injury related to a thrombocytopenia. B. Risk for infection related to bone marrow suppression. C. Impaired gas exchange related to anemia. D. Activity intolerance related to fatigue. Now we go for the question number 2. What is the purpose of administering Allopurinol to a client receiving chemotherapy for AML? A. Prevent gout flare-up. B. Protect the kidneys from tumor lysis syndrome. C. Increase white blood cell recovery. E. Enhance platelet production. Now you pick your answers, and then you see the answer choice in the comment below. Okay, I hope that this video could help you know the key point that you need to know about the acute myeloid leukemia, and then you can apply for your NCLEX exam. I hope that you can pass the exam at your first attempt. Thank you very much. See you. Bye.